Of dollars doled out as part of the Trump administration's rural health care transformation program. Vermont will get more than $195 million. New Hampshire and New York getting more than $200 million. The $50 billion initiative aims to strengthen and modernize healthcare in rural communities across the country. Half of the money will be split evenly among states. The other half will be awarded through a points system based on a set of criteria. Of that second half of discretionary funds, about 20% is based on a state's commitment to specific policy actions. The provision granting states extra points if they agree to implement Trump administration policies has drawn criticism. States will be rescored each year and funds may be clawed back.